Thank you so much. Thank you, Hindi team. Thank you, Sahani sir. Sahani sir is here.
Dr. Anjani, you are starting the session now?
Yeah, Janamdin Mubarak sir. Happy
Ah,
birthday
yes, sir.
to you. Happy long life to you. Thank you so much, sir, for joining with us, encouraging us, everything.
Thank you very
so
much. Thank you very
Strong
much, and all the participants and all, everyone.
Love you, sir.
Uh,
Love you so much. And
Happy birthday, sir. Happy birthday.
Thank you, sir. Thank you, sir.
Wish you happy
And,
birthday, sir.
so on behalf of IFPH, I am once again saying you happy birthday. Bye bye Hindi team. Now we are moving to the English session. Today is our 1843rd day of continuous webinar. Before beginning the session, we will have a prayer. Silent prayer. Thank you everyone for joining with us. Today is our 1843rd day of continuous webinar. We are continuing our journey. Now we are going to celebrate our 5th year on 23rd. All of you must come and join with us. We will meet directly. Thank you so much. Now today's our guest is Rajeshwari Raptha. She is a lady of what I say in Malayalam, we say Sagalagala Vallabha, multi-talented personality. She is and she got DHMS and MBA in Hospital and Healthcare Administration, certified weight loss coach, and a diploma in psychology counseling. Former principal of principal, and she was hospital administrator and ex-professor of head and HOD of anatomy department. Founder of Art of Healing Gurukul, and she got many awards, Best Teacher Award, Bharat Shiksha Gaurav Award, and Adventurous Writer Award. And we are very happy to get you as today's speaker. Thank you so much. You are welcome, Dr. Rajeshwari Raptha. Madam, please unmute yourself.
Yeah. Thank you so much. Your name
Ajini.
yeah, Ajini. Thank you so much, Ajini, for the wonderful introduction, and thank you, IFPH team, for inviting me and giving me this opportunity to present the webinar on ICD 11. And once again, happy birthday to Dr. Sahani sir. I wish you a long, long life and a happy life ahead. Now I see this ICD 11, which I'm going to talk upon. It will be, I think, it will be useful to you all. Some years ago, it was still the beginning of the implementation of ICD 10. It was when I was working for NEBH coordination in the hospitals, and the hospital staff were very worried, like how they can include this as a part and parcel of their work. It was very already a hectic job, for the consultants and doctors and the nurses and all, with the hospital ward rounds and all the work and with the patients and all. So this was something new for them, and it is a part of the NEBS that you need to know about the ICD-10 and ICD-11 at present now. So what is this ICD-11? That is what I was going to talk about, and how it will be useful in case of homeopathy, for homeopathic doctors and homeopathic hospitals. So as a healthcare professional, as I am learning always and relearning and unlearning whatever is useless, just discard it. But keep it in memory that maybe sometimes again it can be useful for you, So learning, relearning, and unlearning is a process of my life. It's a part of my life and also my career. And of course, as doctors, we need to know about at least the codes of the diseases for some medical legal purposes and also for medical insurance purposes. I'm glad to present this 1843rd day of uninterrupted daily webinar of International Forum for Promoting Homeopathy. So as we are promoting homeopathy, it should be a holistic, approach. So, holistic approach also includes learning many new things to make homeopathy a complete pathy, right? So, what is ICD? ICD 11, which we are going to study. ICD is the International Classification of Diseases. And why ICD 11 should be implemented in NABH, especially because it is compulsory, mandatory for people who are, hospitals who are enrolling for NABH, who are getting accredited in the for the NABH. So, what is NABH? I'd like to tell you, National Accreditation Board for the hospitals and healthcare providers. Also, clinics enroll for NABH. Also, hospitals enroll for NABH. The purpose of this is for quality, providing the care. Okay, the care should be quality, purpose, and all. Also, another thing is for mediclaim purposes. Okay, so people get the mediclaims done. Okay, most of the mediclaims have this, policy in their policy that they will only reimburse or they will provide cashless if the hospital is NABH. So that's for quality purposes. So one thing is for the standardization of records, it should be implemented for NABH because NABH emphasizes mainly on the uniform, accurate, and complete medical records. Another thing is ICD-11 provides a globally accepted diagnostic coding system. Now, it is an international classification of disease. When all the healthcare people start implementing it, what happens is globally it gets accepted and people come to know that yes, this is being followed. And even the insurance policies, okay, they follow this, they accept this. So it's a globally accepted diagnostic coding system, ensuring that hospitals, homeopathic hospitals, maintain standardized case documentation. Also, second thing is integration with the national and global health systems. So NABH accreditation, it helps in aligning with the global benchmarks. So homeopathy and NABH and ICD-11. So all these three following the global benchmarks, thus aligning with the global health systems. ICD-11 helping to bridge homeopathy with conventional medicine, allowing the hospitals to contribute to WHO and the national health statistics. Okay, so what I feel is that, we need to align with the global benchmarks and learn the ICD-11 and also follow the coding of the diseases. Third thing is quality and safety. NABH focuses on the patient safety and quality assurance. And this is a part of that. And ICD-11 ensures clarity in diagnosis, treatment planning, and follow-up, so that we reduce the errors and it also improves the accountability. Next thing is, and it's the most important thing, insurance and reimbursement. Suppose your patients come to you with a policy that we have this policy. Is your clinic or hospital giving us the facility? So NABH hospitals must facilitate cashless and insurance coverage. So here again, it's one of the part of that. If you're following ICD-11, it's mandatory for NABH. So it's also a mandatory language of insurers. You may be knowing there is a job profile called as medical coders. That's what they do. There is a special department in hospitals for medical coders. Also, in the medical transcription departments, also they have a specific division for medical coders, and their job is to code the diseases. And each disease is coded by these numericals and alphabets. So the NABH hospitals must facilitate cashless and insurance coverage. And ICD-11 coding is a mandatory language for the insurers. and enabling the homeopathic hospitals to expand financial access for the patients. So it becomes easier for the patients to claim, their insurance. So it's essential for the homeopathic hospitals start getting the NABH done, right? So it's very important. So finances wises. So enabling the homeopathic hospitals to expand the financial access for the patients. Next is research and evidence building. So how you can use this for research and evidence building. Now, NABH also requires a culture of clinical audit and research. So if you have heard this, it will be also important for the homeopathic hospitals to do clinical audit and research using this facility, learning the ICD-11. So ICD-11 creates structured data, making homeopathic hospitals part of the multi-center research studies and policy level decision making. So this is how you can climb the ladder of the success or climb the ladder of the healthcare access globally. Then recognition of the traditional medicine. Now you have heard that WHO has its traditional medicine system department. It has recognized and it has accepted this system as a part and parcel. So there is a global, you already know, homeopathy is the second largest system in the world. So aligning with this global way, ICD-11 includes a traditional medicine chapter. So where it validates the traditional medicine and the diseases, homeopathic conditions as well, and symptoms patterns. And depending on the symptom patterns, it has given the ICD-11. So I will demonstrate that using the website where you can go and find out according to the symptoms how the ICD-11 uses these disease patterns and the symptom patterns to numerize or give the code. Okay, so coming to the advantages of the NABH accredited homeopathic hospitals, how it could prove to be advantageous. First thing is improved credibility so that the hospitals gain the global recognition and trust. So once you have the NABH done, accreditation done, once you start following these norms like ICD-11 and all, you automatically gain access, globally, you will be recognized automatically. Then better interoperability, easy exchange of patient data with other accredited hospitals. So whenever you are sending articles for research or whenever you are, coordinating with other hospitals, when you're using such terminologies, it becomes easier and also accessible and also accepted. Then enhancing the patient satisfaction. It shows accurate diagnosis when you name the disease as per this coding. It also gives transparency and also insurance acceptance. In this way, there will be enhanced patient satisfaction. Next is policy level visibility. So homeopathy becomes part of the national health reporting. So just like other systems of medicines give the health reporting, national health reporting, we can also give this national health reporting, giving them the ICD-11 coding and send the reports to the government. Also, stronger academic and research base. So whatever data-driven homeopathy supports the evidence-based practice. So while we are providing the data, that data based on this ICD-11 terminologies will give more importance. So it will support the evidence-based practice in this way. So in short, ICD-11 aligns with the NABH standards for quality, safety, and accountability. While it also gives homeopathic hospitals a seat at the global healthcare table. So isn't that wonderful? So now coming to the medical billing and coding. because ICD level is also useful for medical billing and coding. That is a part where the insurance plays a role, medical claims and all. So these are two interconnected functions like medical coding and billing that ensure that healthcare providers are paid for their services. And medical coding involves translating the medical information into standardized codes. While the medical billing, it uses those codes to submit the claims to the insurance companies for reimbursements. So there is in the hospital, there is the TPA, there is the medical insurance companies. So all these parts in between is the medical coding department, which plays an intermediary. Okay. Medical coding, the definition of that is medical coding is the process of assigning the standardized codes to the diagnosis, procedures, services documented in a patient's medical record. Now, why this ICD-11 is important when medical coding is doing all the job? Because doctors have to verify what they are given, what the reports they are giving, what the documentation they are providing, whether it is done properly or not. Again, the doctor's role is also important. So the doctors also need to know about the ICD-11. Okay, while mentioning the diseases in their case papers in the documentation, it's important to important to write down the ICD level, 11 terms there. Now, purpose of this medical coding, these codes are used to communicate with the insurance companies, government agencies, and other stakeholders about the services which are provided to the patients. Okay. Now, some of the common code sets which include ICD. ICD is for diagnosis. Whatever diagnosis the doctor has done, that is written in those terms. Then there are also codes for procedures, some interventional procedures if you are done, some angiography is done, or some prosthesis is done, orthopedic surgeries are done. So for those procedures also there are certain codes that is called as CPT. And then there is another types of codes that is called as PCS level 2, that is for the supplies and durable medical equipments. So in this way, there are 3 types of codes. Okay. So usually the doctors, it is essential they know ICD-11. Homeopathic doctors, at least they know the ICD-11 coding. CPT and HCPCS usually is adopted by other healthcare professionals. Now, suppose a medical coder, he might assign a specific code for a diagnosis like hypertension, or a procedure like appendectomy. There is a specific code for that. Okay. And that is sent for the insurance, that this so-and-so the diagnosis is there for the patient by a specific term. Now, all these terms are very important at the international standards because they also have something called as HIPAA, if you know. HIPAA is it's a confidential for the patients and the procedures which are done on the patient, and all the health records are very confidential and they're not revealed anywhere. Okay. So for that purposes, it is very important. And also for the insurance claims, it is of course important. Now, medical billing, it's a process of submitting the claims to the insurance companies and other payers for the reimbursement based on the codes assigned by the coders. The purpose of this, it is to ensure that healthcare providers receive the appropriate amount or the payment for the services they have rendered to the patients. So here there is a exchange of money. The claims are given to the patients as well, and its money is also given to the physicians and the doctors who have done the the surgeons who have done their work. So in this way, medical billing, it's the process of submitting claims to the insurance companies and other payers for the reimbursement based on the medical coders, also to the services that have been rendered to the patients. Now, For example, after a patient receives a service, what happens? A medical biller will use those assigned codes, create a claim, and submit it into the patient's insurance company for the payment. And what happens is the interconnection being medical coding and billing, which is closely linked. The coders will provide the necessary codes for the billers and generate and submit the claims. And then the reimbursement, timely reimbursement is done. So to prevent any hassles in this, ICD-11 plays a very important role. Now coming to the importance of ICD-11 implementation in homeopathic hospitals. You know, if you go and search on the website of WHO, ICD-11, 2019 recently, on May 25, there was a dedicated traditional medicine chapter which enables for the first time the counting of traditional medicine services and encounters. So it's clearly mentioned there. For homeopathic hospitals, this represents a transformative opportunity for legitimization, standardization, and integration into the mainstream healthcare systems. Okay, so just fighting for including or integrating into the mainstream healthcare systems is not enough. We also need to implement all these strategies to become more qualitized and standardized part of the system, right? So what is ICD-11 traditional medicine chapter? There is a core framework, okay, which includes a separate chapter, chapter 26 for traditional medicine. They have named it as traditional medicine at present because we still are not equipped with all that. So once we start getting equipped with that and gaining the knowledge and implementing it into our systems, then of course we can claim that we want a homeopathic uh, you know uh, separate chapter into it where we have these symptoms and we have these terminologies where we can include this, because now homeopathy it can be used for dermatology. So all the ICD-11 dermatology terms that you can just keep a chart of that and start writing those terms in our case papers and start implementing it and presenting it in the research articles and wherever useful. So it becomes recognized then. So for homeopathy and yoga and naturopathy systems, the International Classification of Diseases, ICD-10 and 11 codes of the World Health Organization has been adopted. So scope and coverage, there is a module 1, module 2, and future modules. There is a potential inclusion of homeopathy specific diagnostic frameworks. So there is in the module 3rd or future modules, there is likely to be homeopathy included in that. That's very important that we start implementing that in our systems. Why it is critically important for homeopathic hospitals? First of all, official recognition and legitimacy, global healthcare integration, okay, endorsement by the international organizations, healthcare organizations. For example, you can say WHO inclusion provides a powerful tool for healthcare providers to say it is legitimate medicine. Of course, we don't need any stamp by anybody to say it is legitimate medicine, or we know it's a legitimate medicine, but still to gain access to the global healthcare system or to get included in the mainstream medicine, we need to implement this. There is no harm in implementing. There is no harm in learning new things. So international standardization, homeopathic treatments now can be documented using globally recognized codes. Medical credibility is another thing, bridging the gap between the traditional homeopathy and evidence-based medicine. Then comes the regulatory compliance. Government recognition, supporting the Ayush Ministry initiatives in India, and hospital accreditation, where facilitating accreditation with the national and international bodies, and legal documentation, providing standardized framework for the medical legal purposes. So what happens is when we follow all this, automatically, we gain access to the mediclaims. How many homeopathic hospitals in India provide cashless benefits, insurance benefits to the patients? We need to ask ourselves. So once it starts happening in majority, then we can say that we are coming into the mainstream. Unless that happens, it's still, developing. So regulatory compliance and then clinical documentation and quality improvement, where standardized record keeping, patient management, treatment outcomes, case analysis, it helps in all these things. And safety and adverse event reporting. How many of our homeopathic hospitals report, adverse events? It's one of the part of the NAPH. There can't be anything, like adverse event doesn't need to happen only because of the, drugs or the medicines which we give. Okay, so it's very important, or it can happen. There are homeopathic aggravations also happening. Okay, so either because of the highest susceptibility of the patient or maybe some other reason. So it's not wrong in accepting what's happening. If something has happened, you need to mention it, document it. In that way, a system can always develop. Okay, there is always negative and positive aspects of all the treatments, not only allopathic, also homeopathic as well, or Ayurvedic as well, or any treatment methods, any surgical procedures. So it's very important that the safety and the adverse event reporting should be done. There is a separate documentation for that as per the NABH norms. So current coding includes PL01, complementary or traditional medicine associated with injury or harm in the therapeutic use, which enables risk management, systematic tracking of adverse events, patient safety, enhanced monitoring and prevention protocols. So if we understand something wrong is happening or some adverse event is happening, we automatically develop the prevention protocols. Unless we know what's going on, how can we prove that ourselves everything is right? Then quality assurance, standardized safety reporting mechanisms is also very important. Now comes the research and evidence generation, clinical research facilitation, data collection. It also helps in data collection. ICD-11 codes can reflect the safety and efficacy of traditional medicines, interventions, and supports the clinical research. Multi-center studies. So standardized coding enables collaborative research across the institutions, and evidence-based medicine, systematic accumulation of all the clinical evidences for the homeopathic treatments that becomes evidence-based. And coming to epidemiological studies. Now, recently, during the COVID times, COVID era, there were so many cases which we treated with arsenic, as epidemic medicine. And so many of them got well too because of homeopathic medicines. Many of them didn't even suffer with COVID. But what proof we do have, and how was it acknowledged on the global platform? There is some lack of that. So population health, tracking disease patterns and treatment responses in large populations, comparative effectiveness, comparing outcomes between homeopathic and conventional treatments. Using these terms, we can start doing all these things. Public health planning. So informing the policy decisions with standardized data. All this can be done for the epidemiological studies. Then comes the financial and insurance benefits. As we already discussed, it helps in coverage expansion. Insurance companies can systematically cover the homeopathic treatments. Revenue enhancement. In this way, homeopathic hospitals can bill the insurance for previously uncovered services. Financial sustainability improves economics for the homeopathic healthcare delivery. So This is one of the important thing in insurance reimbursement. Also, it improves the healthcare economics. How? By cost-effective studies, by standardized data enabling the economic evaluations, and resource allocations, better planning and budgeting for the homeopathic services. Also, investment justification. Now, when we have the data, we can argue for expanding the homeopathic facilities. Once we start receiving the insurance benefits and the patient starts getting the benefits, again, we can go for standardizing, the system. So in that way, we can put more investment also. Then integrating with the mainstream healthcare, for which we are all interested, right? So interoperability is also one of the important thing where you want to get integrated with the mainstream. Electronic health records, which ultimately give the evidence that homeopathy is working for so and so diseases. Ultimately other streams will also get interested. Yes, we want to integrate with your system. We want to consult with your consultants for these so and so diseases. In this way, there will be ultimately integration of the mainstream healthcare with the mainstream healthcare. So seamless integration with conventional medical systems can happen. Care coordination, better communication between homeopathic and allopathic providers. Referral systems. Now that will also improve. Standardized protocols for patient referrals in between the systems can happen. Then multidisciplinary care. There will be team-based approach. Homeopaths can participate as equal members in the healthcare teams where there will be discussions, there can be arguments, there can be, integration of the systems. They can plan that how treatments can be integrated for the patient betterment. Also, consultant services, systematic integration of homeopathic expertise in complex cases. We all know that how complicated cases we treat, that pictures and all which we show before and after, such dangerous, horrible conditions before and then after, such a clear and beautiful picture of the patient and the patient testimonials, such wonderful testimonials. All these, in such complex cases which really, are wonderful. So there will be, homeopathic expertise which we can integrate. People will come, other consultants will come and discuss the cases, complex cases which they are not able to cure or which they are not able to treat, right? Then continuing education. Standardized framework for training conventional physicians in homeopathy. So there is no need of any bridge course, but we homeopaths will start building a bridge course for conventional physicians. So they learn homeopathy and start integrating with homeopathy, curing such diseases. For that, we need to, start implementing all these. If someone doesn't understand a language, what we do, we use the sign language, but that is insufficient, right? So what we are using is the sign language at present, but we need to learn their language so that, it becomes integrated fast and, there is a betterment for the society and the patients. Implementation challenges and solutions. So there are certain limitations, current limitations I will discuss. That is homeopathy specific codes. Now coming to the website, when we go and see the website, it is based on the traditional Chinese medicine and Ayurveda at present. But there is a choice option for providing it for homeopathy as well. So current ICD-11 primarily focuses on traditional Chinese medicine and Ayurveda. There is important training requirements. Hospital staff need education on new coding systems, technology infrastructure. Electronic systems require updates to accommodate new codes. There is a need for strategic implementation approach. Okay, so first, there is a need of a foundation where staff training, systemic updates, and policy development should take place. In the second phase, there is a basic structure in how the implementation can take place. Okay, how the policy makers need to focus on this so that homeopathy gets integrated, or the conventional system gets integrated with homeopathy, either ways. So policy development should take place. Integration should happen where pilot programs starting with select departments or conditions, disease conditions, quality metrics where establishing benchmarks for documentation quality, workflow optimization where streamlining processes for efficient coding. In the third phase, one need to go into full implementation. Now, this will take around 3-4 years to complete, but the start should be now. That's what I think. Hospital-wide implementation of ICD-11 coding, that will be complete rollout, and performance monitoring, tracking outcomes and continuous improvement, collaborating with other institutions for best practices, also giving special benefits for different hospital departments like OPD clinics, appointment scheduling, treatment planning, length of stay. All these, can be improved by computerized systems and, data-driven optimization for treatment durations. Also, in emergency services, acute care integration can also be included in the homeopathic emergency protocols with standard coding. So we can develop our own standard coding system. Okay, and triage systems. In triage system also there are certain codes where it can be incorporated with traditional medicine assessments in the emergency care. Also follow-up care where seamless transition from emergency to ongoing homeopathic treatments. So in this way, emergency services under 3 steps it can be undertaken: acute care integration, triage systems, and follow-up care. And further, in the research departments, you can again optimize into clinical trials, publication quality, and grant applications. So in this way, you can implement it into homeopathic systems. Okay, I think, is it interesting or not? Now, let me take you to the website where you can find out how the clinical implementation can be done, how the implementation can be done, ICD-11. Yeah, so this is the traditional medicine system of the WHO. I don't know, some of people may don't accept what WHO says, but still, this is a thing which is accepted by the NABH and the other global. It is accepted globally. So you can go through all this, and for implementation, see, there are certain topics which you can go and search for. Those were the emergency ICD codes. So you can explore this website and you can find out or we can follow up with questions if you have any.
Thank you, madam. So, have you finished?
Yeah, I'm just searching the data for for showing you how to search, in this.
Yeah, most of us don't usually use this ICD codes, no?
Yeah, so let me tell you that medical coding and billing is one department where most of the homeopathic doctors are also, doing the jobs.
Yeah, I know.
Okay.
In,
Yeah.
in
So
other
it's
countries, more
yeah,
than
it's very important for all of us to know that when they are doing the jobs, okay, and the payments start from 60,000 to 1.5 2 lakhs.
yeah.
Okay. So let me tell you, youngsters come to me asking me that, madam, we are doing so and so, we are doing the OPD, we're not earning so much. Sometimes they come and ask me and they want to earn fast money. You know, so this is one of the careers, important career also for them. That is what I want to tell you. And apart from being a career, also earning fast. Second thing, it's also accepted worldwide. So not only in India, they can go abroad and earn also. So they have opportunities worldwide. Another thing is implementing into hospitals and into our homeopathic system will also take us worldwide. Okay, and help us, getting included into the mainstream. So this is the summary of this webinar. Yes, any questions included? You can just ask me if you have any questions.
Actually, what I want to ask you, if we don't have such books, how can we have to search in the books, right? With ICD coding 11 and all. Otherwise, how can we see these codes in our practice? I mean, without the book or without learning, can we?
No, it is a open source, ICD-11 is open source. You can search in the Google, you have archives, you have, full data about all the diseases.
So while
Yeah.
searching in the Google, we
Yeah.
have to put the disease and
Yes.
get the code, huh?
Yes, if you know the diagnosis, you can just put the disease name and you get the code for it. There is a specific website. That is what I was searching. I don't know why it's this thing is crashing. The website is crashing. I don't know why it is happening. So
Yeah,
yeah.
most of we don't usually use this. Even we don't know the importance of ICD coding, but even though your class gave awareness to us for that, but you said that now they
Have you heard about NABH?
No.
Yeah, so IRDA recommends NABH, NABH accredited hospitals. Okay, they provide the facility of cashless benefit for the patient, also reimbursement benefit for the patient by the insurance companies. So if you have a clinic which is NABH accredited, or if you have, it is also available for the Ayush clinics. Also, it is available for the hospitals, NABH hospitals. How many homeopathic college hospitals are NABH accredited? How many private homeopathic hospitals are NABH accredited? I think we can just count on fingers.
Yeah.
Okay. So that is the case. That's why we are not able to compete with other
Yeah.
hospitals, And once that starts happening, once you start implementing the NABH in the homeopathic hospitals, once you have your private clinic which is NABH accredited, then you know what is quality and how you are going to present your cases and how you are going to go to the world standards. So this is very important. Even if you're not getting accredited, go to the NABH website and study what are the requirements and what are the things they do. Automatically, you'll come to know. So all the homeopathic doctors, all the homeopathic organizations, my special request is that go through all this and you come to know about quality.
Exactly.
And what is done in the hospitals to acquire the NABH status. Okay, it requires a lot of documentation. It requires a lot of quality care. It is a totally accountable thing for the doctors and the healthcare staff while you're undergoing NABH. Because I have done the coordination, I know that what is the training for. So here I finished my webinar. And if time permits, next time I will show how to search for the ICD codes and how to make it. For example,
One thing I wanted to ask you, in this ICD-11, you mentioned that they have included Ayush.
Yes. Ayush hospitals, yeah, there is Ayush. I have done the Ayush certification course, POI, and there is certification done by QCI. website, if you go to QCI website, you go to NABH website, there are training
QCI
courses.
website, right?
QCI website and NABH website. If you go there, you can get trained. There are training courses. You can go and get trained there. And because I had done MBA and I was working with coordinations of the hospitals and this work, NABH work, so I did the training and I was doing training for HIC as well, hospital infection control. That's a part of it.
Okay.
So through that, I knew that I thought that how wonderful it would be that if we implement all these things into homeopathic hospitals,
But
and
most-
that will acquire the
Very
the global
homeopathic
yeah.
hospital is very rare. Most of us are running clinics, right? So,
And that is where we are lacking, clinics is
yeah.
okay. We need to have our own clinic, but there is a need of hospitals, more and more homeopathic hospitals where, patients can be treated for their whatever diseases, all their diseases,
And one more thing I wanted to ask you, in this Ayush chapter, what it is mentioned? Is it about the disease or I couldn't get you? What? Normally,
See, Ayush, no, what we are talking is about NABH is different and ICD-11 is different. In NABH, you have a special course for Ayush hospitals and
NABH.
clinics.
In NABH, okay.
NABH. In
Okay.
NABH, you have a special training for, NABH accreditation of the clinics as well as hospitals.
In NABH website, we have separate chapter for the Ayush.
Yes.
Okay.
Let me show you.
Yes, I was thinking in the ICD coding only the disease and code.
No. No, that is different. That is different.
Yeah. So now I got it. Thank
Yes.
you.
Yeah, let me share and I will show you this.
Not yet started sharing.
So now I can't show you because it's asking for this thing. Your
Now started.
yeah. So you see here is the
NABH Ayush entry level certificate.
yes. So this is for the if you're opening a clinic, you want to get it certified, entry level certification. You want to get it done. So you need to register here first. Register here and fill in all the required documents.
Yeah.
Okay, you have whatever requirements are there, all those requirements, you have to study the requirements first and then you have to get equipped. Your clinic should be equipped for all that and then you have to send them all the certifications. It will require waste disposal certification. It will require the electricity backup requirement. All these requirements are there, certifications and registrations. All those documents you have to fill in. How many team members are there? What are the staff working in your clinic? All these things. There are minimum requirements also. So all this you have to get done and then they will come for an inspection and then your entry level certification will be done. Okay, once entry level certification is done, then the final certification is also there. So once it is done, then you will be free to get your patients when they come to you. You can give them reimbursement, cashless claims and all that. So it is helpful for that. Then IRDA registration, so many things are there. It's a special course. So if you undergo the training, you will come to know all that. Okay. Go to the NABH website and QCI website. You will find all those things. If you want to explore, you can go and explore.
Thank you so much, Dr. Rajeshwari Raptha, for your it's a great awareness for us. Like many of us are unaware about the ICD coding and all. Even though we know something, but as you mentioned about the NABH website and the Ayush chapter is included. These are the truly it's a new knowledge. I don't know. Maybe others might have idea about that. For me, it's very new things.
No, many of them know. When I was undergoing the training, there were at least 4 or 5 people from homeopathy.
Mhm.
and around 10 people, 10 to 12 people from Ayurveda colleges.
Uh-huh.
So yeah. So colleges have this mandatory requirement to get NABH done
Uh-huh.
for their hospitals. Now I don't know how many of the colleges are doing it.
Yeah.
So
I don't know.
yeah.
Where to get this certification? Where you have done this? This NABH?
It is available at various centers. No, they announce it just before the exam. They have their exam also, so they announce it on their website or they send the email, registered email. So you just go and explore. You will come to know all the things. And if you
Right.
haven't it out, you can personally ask me. No problem. You can contact me.
Thank you so much. Thank you so much. And thank you for your excellent speech about the ICD coding, NABH, and IRDA website, everything. Thank you so much. And come again and give more idea about all these things, because we have to get more idea about all these things. Thank you so much on behalf of IFPH. Come again. Bye bye. Thank you. And
I have given my website and email on the chat box. You can contact me.
and the participants, if you have any questions, you can raise your hand and ask question. No one is raised hand, and that's why I'm I'm talking.
Thank you. Thank you. No worries.
Anyone have any question regarding this? Otherwise, you can contact Dr. Rajeshwari through her email and ask her about these things. Anyway, thank you so much. Now we are moving to the Malayalam session.
Thank you so much and have a wonderful evening. Bye.
Bye. Thank you. Thank you. Thank you all the participants of English. Now today, this is the end of our English session, and I am inviting Dr. Shaila for moderating Malayalam session. Dr. Shaila, you are welcome. And Dr. Danesh,
Yes,
before beginning the session, you can.
yes. Good evening, all. As you all know, the International Forum for Promoting Homeopathy is celebrating its 5th anniversary on 28th September at Taj Vivenda, Cochin. I hope all of you will register for the same, and we have an exciting news for you. Our Rice Minister is coming over here and to inaugurate the session. So that's the latest news from the list of IFBH anniversary, 5th anniversary celebration. Please register for the same, rupees 3,000 per person.
If you have not yet registered, you have again, we are giving time to register. Please make it fast. We will meet together and celebrate together. Really, we are eagerly waiting to see you all. And now I'm inviting Dr. Shaila for moderating Malayalam session. You're most welcome, Dr. Shaila, please.